and listening to our questions. Representative Ryan's cut to Medicaid funding and the proposal to turn Medicaid into a block grant to states could cripple the program that covers 15,600 seniors and 25,700 people with disabilities here in New Hampshire. These are among the most vulnerable citizens we have. Under block grant system that does not increase with need, and with the state's budgets as they are, states would have no choice but to dramatically cut benefits. As a county commissioner, what I expect will happen then is that the cost to administer our nursing home, where a majority of our residents are on Medicaid, would rise. These costs would then have to be passed down to our county taxpayers. How do you stand on this issue of increased funding for Medicaid?
Well, the way Medicaid works right now is the federal government will match, based on a fee-for-service program, what states are spending. And what you're seeing, given the fact that we have growth in the number of people who become qualified each and every year, and that's based on 50 different notions in 50 different states, you're seeing an inability at the federal level to continue to fund at this growth rate. So the idea was, in the discussions in Washington, is how do we try to preserve Medicaid and Medicare? How do we protect it to make sure that it's there for those who are most vulnerable as a social safety net? And I support the notion of preserving Medicaid. A lot of people who require it, a lot of people depend on it. So I think it's imperative that we protect it. I'd also add that if we do nothing, it is not sustainable at the current levels. And I don't think that's fair to anybody who's currently receiving that benefit. So the idea of a grant to each state is essentially two things. You remove the federal restrictions. You say to New Hampshire and every other state in the country, here's the amount that you're going to get, and it would be the amount that you received this year. And then each year thereafter, there would be a growth rate increase each and every year. What the state then gets is the flexibility to manage those dollars in every way they see fit. Now, I've had a chance to talk to Commissioner Toumpas about this, and I've asked him personally, can this work for New Hampshire? Will it be able to be successful? And he said, so long as we have the flexibility to make our own decisions, this can work. I've heard this from other governors across the country as well. So given that, we do three things in the proposed plan in the House. It actually saves the program. It gives more flexibility to states, state governors and legislators. And it changes the fee-for-service match to here's the dollar amount and manage it. And every state is going to be different in terms of their demographics and their needs. And the hope and the expectation is that we can see 50 different ideas growing and being created at the state level. And when there is something that works, let's utilize those ideas and examples in other states. What doesn't work, we'll stay away from those things. But it's the notion of having 50 states as incubators for good ideas and how to manage these resources, and ensuring that we actually preserve the system. Because if we don't make some changes, there are bipartisan groups, including the President of the United States, who has said it's not sustainable at its current spending levels. So I think we are in a position of responsibility in Congress to do something about this. We know there's a problem. We know there's a problem. How would we feel as a country if we didn't solve something we knew was there? And we also do this, I think, for our kids and for our grandkids. Most people that I talk with say, we have a problem. I think most people understand that we've got a debt and a deficit, and most people will tell me that it's not good public policy to run those debts and deficits. And that so long as there are fair and equitable ways in which to solve these problems, most people say to me, I'd like to be part of the solution so we don't create a greater problem for our kids and for our grandkids.